A tonsillectomy is a surgical procedure to remove two small glands in the back of the throat called tonsils. If you or your child has signs of infection in your tonsils and repeated treatment with antibiotics is ineffective, your doctor may recommend that they be removed. Here are some common symptoms that may lead to a tonsillectomy: frequent sore or strep throat, recurring tonsillitis or swollen tonsils, trouble swallowing, fever, pain in the back of the neck area. If your doctor examines you or your child's throat and finds a coating or discoloration on the tonsils, they may recommend a tonsillectomy.
Well, it looks like the tonsils are going to need to come out.
Other reasons your doctor might recommend a tonsillectomy may be to relieve breathing problems, help with sleep apnea or snoring, which can cause sleep disorders, or if there is repeated trouble swallowing while eating or drinking, a tonsillectomy may be recommended. Millions of people are living normal lives without tonsils. So what do tonsils do and why can they be removed? Tonsils are small glands in the back of the throat that contain white blood cells. White blood cells fight infection in the body by trapping germs that enter through your airway. Even when tonsils are working properly, they can get swollen and sore. It's when tonsils are constantly showing signs of infection that they can become a problem. Removing tonsils doesn't cause any permanent damage to the throat, and the body's immune system quickly replaces the work of the missing tonsils. Children and young adults tend to suffer a higher occurrence of strep throat and sore throat, so a tonsillectomy is performed more often in younger patients. If your doctor recommends a tonsillectomy, you should understand that it is a relatively routine operation, but all surgeries have some risk. Your doctor will not recommend a tonsillectomy unless it is necessary and the best method to restore health. Please refer to the Pahoola video on how a tonsillectomy is performed, but here is a brief explanation of what to expect. Your doctor will give you a specific set of instructions on what to do on the days leading up to surgery. In most cases, as early as 10 days before surgery, the patient will be asked to stop taking aspirin, ibuprofen, or other drugs that cause thinning of the blood. If you or your child are taking other medicines, your doctor will tell you what can be taken and what should be stopped.
He will be, yeah.
Normally, on the day of surgery, you or your child will be asked not to drink or eat anything several hours before the operation. An empty stomach generally responds better to anesthesia. Remember too that because a tonsillectomy is performed under anesthesia, in the case of an adult, someone will need to drive the patient to and from the hospital. Tonsillectomies are usually, but not always, performed as outpatient surgery. Children under 3 or a child or adult with other medical problems will be admitted. But normally patients will go home the same day, after a short stay in the recovery room. The doctor and hospital staff will determine the schedule for leaving the hospital. Pahoola has prepared a complete video on recovering at home from a tonsillectomy, and we recommend you view this video.
Mom.
A tonsillectomy is a relatively routine and common operation. Your doctor will have specific instructions for you to follow. After a successful tonsillectomy, there should be no lasting negative effects or scars.
Okay, so let's start with yogurt. Okay.
The discomfort of sore throats, sleep or swallowing problems will be gone, and life will improve without tonsils.